won't drink my gin now, I promise.
Hello, Cam followers. I am so excited about tonight. This is really important to me. You probably will question what the topic is going to be about. A lot of Cam followers come onto our page, watch our lives because they're wanting intervention advice. They want to have advice about the latest treatment, a different therapy that they can incorporate into their treatment plan. However, something that's often overlooked and is a massive part of this long-term management is communication. It's about building rapport with your vet. It's about decision making. And this is so often forgotten because in this part of your dog's life where they have got a long-term condition that you're going to have regular interventions, you've got lifestyle change, you do get trapped in a little bit of a decision paralysis. There's so many things to be thinking about. And if you've ever spent any time on our community page called Holly's Army, you'll see owners seeking advice of other owners because decision making is very, very difficult. Now, let me introduce you to two of our lovely people. This is Kathy Murphy. You've seen her before. She runs Barking Brains, and very dear friend of mine. And this is the lovely Polly Taylor, who I've managed to track down. I've been waiting 6 months to pin her down because she's extremely busy. And both of them are anaesthetists. Please do a quick bio about yourselves because I will get it wrong.
A veterinary surgeon, veterinary anaesthetist, neuroscientist, director of Barking Brains, which is neuroscience outreach for the training and behaviour community. So I have an interest in dog behaviour and training. Dog owner, dog enthusiast.
Exactly.
Yeah, I'm really, really passionate on animal welfare and ethics, and particularly around ethics within our profession, so within the veterinary profession.
Perfect. And Polly?
I'm Polly. I'm an anaesthetist and have been for a very long time. I originally worked in general practice and found myself doing anaesthesia and decided I should do it a bit better. Worked first at the vet school in Cambridge and then in the Animal Health Trust and then back at Cambridge. And since 2002, I have been a freelance anaesthetist. So I do quite a lot of anaesthesia for people who are doing research. I also teach locally in practices. I'm involved in quite a lot of research, particularly in pain management. And I've recently got concerned about ethics and how we aren't really always putting our patients first, but we're getting carried away with gimmicks and things that look cool.
Yeah, so that is why, having met Polly again, because Polly actually taught me at uni.
A long time ago.
So I saw Polly do the opening talk at the AWF debate 2019. And your topic is just because we can, does it mean we should? And it was powerful. The room was absolutely in awe. And it's a situation where there's a slight counter argument and there's discussion and debate thereafter. So I'm going to let Polly lead on this topic because a lot of you followers do have to make decisions. Some of them are big ones. So sometimes we've got dogs that might have, say, spinal arthritis, lumbosacral disease, or severe hippoarthritis, or you're looking at an arthrodesis. You know, these are big decisions. Joint replacement surgery, especially of, say, the elbow, of the stifle, of the shoulder. These are really, really new thoughts. And the evidence behind them is sometimes lacking. So this could be quite a pertinent conversation to people that are in that position. Let's let you lead. You know, let's go back to the AWF debate and how you started your conversation.
The place that I really started was the oath that every veterinary surgeon, certainly in the UK, swears when they become a vet, is to put above all else the welfare of animals committed to their care. And in this day and age, we have got lots of super toys to play with. We have wonderful materials. We have incredible diagnostic facilities. We have some amazing treatments. And it's very easy to get carried away with something that looks new. It looks as though it should be better. And I'm sorry, it looks cool. We get carried away with doing what we think is the best for the animal. But actually, every now and then we need to stop and think, is this really what Fido really wants? And that's really where I'm coming from, to make us stop and think about putting the animal first.
And you You did talk about some solutions that could be easily incorporated into first opinion. So let's think about first opinion practice situation. The ability to discuss and have an ethics community, have people within the practice that you can take that case to have a bigger debate, isn't it?
Yes, I think it's very important that the whole team is able to stand back a little bit from the case and look at all the aspects. So you've got three stakeholders, if you like. You've got the clinician, you've got the animal, and you've got the owner. That's you. And it's very important there is somebody who is an advocate for the animal, and that isn't always the owner, because it's very easy to get tunnel vision into thinking you're doing the best for the animal and not actually stopping and thinking, how is this really affecting my dog? And it's perfectly possible within any practice to have a group of people who know that they are available to discuss a case when there's something complicated that may need to be done or a difficult decision to be made, that you can actually stand back a little and look at the pros and cons of each of the potential treatments or the one treatment that you're looking at, still putting the animal first rather than being carried away with what is the latest apparently perfect treatment.
This is a really difficult one. I'm just going to put a little bit of context in my mind for this, because so a lot of you know that Holly was the flagship dog for Cam and lost her last December, sadly. But about 3 years prior to that, she got diagnosed with a hepatocellular carcinoma. So she had a gigantic liver tumour. It was a real shock. It was hidden under the rib cage. Her clinical sign was she was eating a lot. And I just thought, oh, she's getting a bit of dementia here. She's just seeking food all the time. I didn't put 2 and 2 together until she had a blood test, a regular blood test. And it was like, whoa, liver tumour. So I suddenly became the owner. And these were big, big decisions to be made. In that I spoke to 3 surgeons. I got information from everywhere. So I was in a very fortunate position. I did have a committee because of the nature of my work. I could discuss with my colleagues in quite a cold light of day conversation, you know, what are the pros, the cons, what are the probabilities, what am I going to expect thereafter, what might happen. And I was told, you know, during surgery, she might die on the table, she might need to be put to sleep on the table, etc. But I had to make a big decision about an op that was totally 50-50 whether she'd survive it or not. But the chances, if she survived it, that she was going to have a very comfortable life, normal function thereafter, were very, very high. So that was very clear to me. It was 50-50 on the table. But if they were able to remove the tumour in total, she could go back to a normal, good quality of life. And that was something that made me go, okay, I'm going to go for it. We, in the musculoskeletal situation, sometimes don't have the normal quality of life thereafter, do we? If that makes sense.
Yeah, and I think, I mean, there's a lot to consider. It's not just like you said about the success rate or not of the procedure, although usually you find that the conversation is centered around that. Actually, from the animal's point of view, that's an acute situation. So yes, it's not very nice for them to go through, but it's relatively short term. You also need to consider the long-term impact. How many times are they going to have to come back to the vet surgery? What's their personality type? So is that a really stressful event for them, or are they quite comfortable in that environment? Are they going to have repeat blood tests? Are they going to have treatments that they don't particularly like, maybe injections or tablets, and they don't like taking tablets? Maybe they do, and so that bit would be easy. But these are all things that need to be considered. So the burden of the treatment afterwards needs to be considered, as well as the initial burden of the surgery. And then, like you said, the ultimate outcome. I mean, in human patients, the reviews that have been done in the literature show that between 2 and 10% of surgical patients suffer severe chronic pain.
That's so crazy.
Now, we have no idea what percentage of our veterinary patients suffer severe chronic pain, because we just simply don't look for it.
No.
But we know that there are some patients that obviously show severe chronic pain after surgery, but we have no easy way of evaluating it because we can't ask them. But to know that 2 to 10% of human patients that undergo surgery have severe chronic pain means that it has to be something that should be incorporated into our decision making. And we know already from research in animals and humans that animals that already have a painful condition are more likely to suffer severe chronic pain. Animals that have high anxiety are more likely to suffer severe chronic pain. So some of these other things around looking at the patient as a whole, I think, are really important when you're deciding about whether to go ahead with a procedure or not. Because it's very easy, like Polly said, to get kind of carried away, and I've been in that position as an owner. You kind of only want, because it's so stressful and emotionally draining, you only want to think about the next step. But actually, once you take that step forward, you're then invested in, well, maybe I should just take the next step, just take the next step. So I think stepping back and being able to discuss the whole of the situation.
And the scenarios that might ensue.
Yeah.
So we could obviously talk about the disaster scenario where the op didn't go according to plan, and now we're in a position, do we revise the op for it with another op? And these situations do happen, and a number of people that follow Holly's Army, you know, they have all different kind of scenarios have happened. You know, there was one guy on there that had, his dog had a bilateral hip replacement, and both of them failed, and both of them were turned into femoral head and neck excision. You know, there was a fake joint, and it was a bit of a disaster, you know, to have that much bad luck. But, you know, how can we help people? And if you have questions, please do ask. Angela, I've had this conversation with a friend a couple of times. I've never put my dog through surgery because I know he couldn't cope with surgery. He can't even be examined by a vet. She was surprised, and I said the same. Just because you can do something doesn't mean it's the right thing to do in all situations. Yes, thank you for saying you love this topic, because it needs to be talked about. Because as a vet, when I give people their options, I don't want them to feel guilty that they haven't taken the most complex, comprehensive, you know, invested, expensive. I don't want them to feel guilty of saying, that's not where we need to go. We're going to go this way. And I hope you'll support us, because we will.
It reminds me,
I think not being made to feel guilty is probably the most important thing of all. Now, if it's something like Holly's case, it's perfectly acceptable that you go to that point, that once she's anaesthetized, she doesn't know anything at all about what's happening. It doesn't matter whether the surgery took 5 hours or half an hour. She doesn't know any more about that. What becomes important is what comes afterwards. It's the care that you've got to give her. It's how much pain she's in, how much she's debilitated afterwards. And it's that sometimes gets forgotten. You think, oh, you can do this simple piece of surgery, but what about the care afterwards? And you absolutely should not feel guilty if you make the decision that the post-operative care that's got to come afterwards is not tolerable either to me or to the dog. And it does apply to you as well. It's very well recognised. There's a huge carer's burden. And you get to the point where it's so awful, you resent the dog, it breaks down the relationship between you and the dog.
Or you just feel horrendously guilty because you're the type of person that now resents the fact that you've got to give this treatment, or that you can't afford this treatment, or that you can't cope with the situation.
So what's best for you and for your dog is the right thing to do. And don't feel guilty if it's actually cutting it off sooner than perhaps your neighbour might do.
And I must admit, like when you were saying about the post-operative care, so when I went and collected Holly, so she'd had this major surgery, she'd had a diaphragm cut, she had a thoracotomy, they'd resected 2/3 of her liver, she had a blood transfusion. Thank you, Professor Nick Bacon, thank you. And she survived the surgery. But I must admit, when I was getting the updates for the few days afterwards, I did sit there going, what have I done? Because she was unwell and she was painful. And luckily, for my sake and her sake, she came out of that period reasonably quickly, and we saw, you know, we could plot that her pain state was improving, and we were controlling it, and she did start drinking and eating, and it happened in quite a short period of time. You know, so 2 days she'd already started to take some food in. So phew, I was so lucky. But there are periods where you go the first step, and then the second step doesn't go according to plan. And then you feel really caught that you need to stay with it because you've gone this far, you must stay further. That's something that I think is really hard for owners as well.
I think that's probably the most difficult bit of it all. And I've done it with a cat of mine, absolutely fabulous cat that got feline dysautonomia, Kigaskell, yes it was. And I took her into my local vet school because I hadn't got facilities at home to do all the drip. And you start on it. You think, oh, it's not too bad at the moment. Put in a feeding tube, keep it eating. And I kept on going because there was always a possibility he was going to get better and get completely better. And he got to the stage where I went to visit him and he was miserable. He got Elizabethan collar on. He started to vomit. I should have said, stop now. And I regret forever that I didn't say stop now. But 2020 hindsight is so much easier.
Oh, so easy.
So it's that feeling that you must not feel guilty if you say, I'm not going to go beyond that point, because that is the decision for you and your animal. And if it's beyond what you can stand and what the animal can stand, that's it. Please don't feel guilty.
No, I've got a similar feline aortic thromboembolism. And I must admit, I'm going to put my hands up, I've only managed one to this point once in my 19-year career. And it was 3 weeks in hospital. We did everything. And then it went home and it blew another emboli and it died at home. And you sit there going, oh my God, that cat went through so much. And how do we help owners with those kind of decisions though? So we were talking earlier about a clinician's role. So I'm going to go straight to the blunt end here. We are taught academically and we have facts and figures and possibilities in our head. But then turning ourselves into a counsellor to then put it into this suits you, this would be suitable for you, is way different to the way that we actually get taught. I was very textbook based, we had a very set way of learning and it was, fact to the best that we had at the time. To then turn into an advisor is quite hard because you as the vet struggle between giving fact and advice. And then you go from science to art a little bit. And then we get into this murky zone, don't we?
I mean, maybe, or you just stay focused on welfare because I think part of the case workup, we would call it as a vet, we would call it a case workup. We're working up the case to decide what's the appropriate action. Part of that has to be discussion about the individual patient. And I think the questions that make a difference for me when I'm supporting people with these sorts of decisions are things like, well, what does he usually like to do? Like, what's his favourite lifestyle? Does he like running and chasing balls? Does he like cuddling up on the sofa? So you start to get a picture of actually what that pet's preferred lifestyle is and what their character is. And then you can map that onto how likely is it that they're going to be able to do that after this procedure? Because that comes back to there isn't a correct way a case. You can have very identical pathology, but if you've got a difference in personality or a difference in lifestyle, it can make the world of difference about whether that treatment's the right treatment or not.
I think
so for instance, for those guys who are on barking brains, also about Nancy, my rescue Rottweiler, it wouldn't be appropriate for me to put her through a procedure that required prolonged repeated vet visits or prolonged treatment, partly for my own safety. Just because it would really massively stress her out.
I got here and she took something out of my bag and I went to take it back and she went, I wouldn't.
And then Hannah said, can you ever take anything off her? I said, well, I don't. You're welcome to try.
And I said, okay, I won't.
So for her, the treatment decisions would be very inappropriate for me to say, yes, go ahead with chemotherapy, for instance, even if the chances of recovery were very, very good. Because for her, that would be an absolutely awful procedure to go through, a prolonged stressful procedure, and that wouldn't be fair to her. Whereas there might be another dog that's perfectly happy to have its bloods taken and have treatments and wags its tail to go into the vets for a treat, who might be able to cope with that.
Do any tools exist that you know of that can help an owner think in this manner? It's almost like I feel that we've jumped to the end of the flow diagram and then we bounce back to the middle. And it's almost like you feel that on the right hand side of the sheet of paper you want the lifestyle that the dog likes, and that's what we aspire to get back. And then on the left you want almost what's the likelihoods, the options with the biggest likelihood to get there.
There are some sort of mini scoring systems that have been developed for specific diseases.
Okay.
Where you can look at specific things like appetite, enjoyment of chasing ball, and you can give them a score from 1 to 10 or 1 to 5 or and some of them have been more used than others.
Yeah.
And you can say that as long as he's below 3 on all of these things, I think this indicates that he's happy. But if we go beyond 3 in more than 2 or 3 of these things, then I've got to start saying, is this dog really enjoying life?
No, and I think that's wonderful. And I think over the next, say, 10 years, I can definitely see another element to our profession developing. So when I qualified 19 years ago,
That's nothing.
when I qualified, behaviourists were still expected to kind of work within a half an hour in practice. They weren't given the tools and the capabilities that they have now. So if you were to see a behaviourist, they quite often come to your home. You're going to be there for an hour and a half minimum. There's going to be repeated visits. They've blossomed into this beautiful profession. I can see that there's going to be another part to our profession, which is going to be discussion, decision making, helping people on their journey with their pet, because I think it's needed.
Yeah,
you know,
and it's needed in a much longer time frame than a 10-minute consult.
Definitely,
that's the challenge.
Yeah, and I don't blame the vets, because
No.
we are dictated with the 10 to 15-minute consults. You know, and quite often when you're behind that desk in a first opinion setting, I'm trying to talk to the owner, there is the gremlin in the back of your head going, you've still got 2 dogs that have got to have dentals, you've got 4 consults before lunch. You know, it's very, very difficult. So it's kind of an interesting idea whether a counselling role will come into play in first opinion practice, because these decisions happen a lot, don't they?
Yes, and I think your earlier point about you're going to get sucked into a treatment. You know, you've got so far, so you feel you've got to continue, which is where I think having stop points, if you like, that make you not necessarily go straight for euthanasia, but go stop and think, should I really be going beyond this if this happens? So it adds a bit of objectivity to it, which helps, because it's something that's very
You can almost do that with hospital charts. Like, you should have, you know, every hospital chart will have a box that says, stop, now rethink the case. Are we still in the right direction? Because I know from a first opinion aspect, I've got no amazing qualifications. I'm a groveler. I work really hard in first opinion practice.
I don't know if that's a fair
reflection. But there are times where when I look at a case, and it might be, say, a dog that has got liver disease, it's in on a drip, it's really quite uncomfortable, it's really nauseous, you know, this has been going on for a long period of time, and we're 2 or 3 days into the treatment plan, and I'm thinking to myself, if I suggest giving up, my colleagues will probably think that I don't commit, I'm not trying hard enough, you know, let's give it more time. So even within the practice, it can be quite difficult when your opinion of what you would be willing to do your dog conflicts with what you're seeing and managing. Does that make sense?
Yes, but if you've made a few decisions beforehand that if we've reached this point, we maybe not actually this equals call it a day, but it means you stop and rethink that, is this really financially, welfare orientated, fair on the owner, all those things that have got to get looked at, rather than that constantly trailing on in.
Yeah.
Is it worth talking about Herwig Grimm's ethical review committee and how that functions? Because that's really it's well set up and it's working really well, isn't it? And showing that you can use that in a kind of here and now within a clinical setting,
and in the middle of the night if necessary.
Yeah.
Tell us about it. I'd love to know.
No, you go. Is it I can't even remember which university it is.
Yeah, it's Vienna.
Okay.
And it's the Equine.
Yeah, so at the Equine Clinical Hospital in Vienna, they have an clinical ethical review committee. And so any clinician can bring cases there. Any clinician or owner could bring a case there. So typically you'll have cases that are seen within the hospital, and the clinician will say, I'd really appreciate bringing this to the ethical review committee. And that can be formed very quickly. So they're on emergency call out, if you like. Yeah. The committee is made up of a variety of different people. So there'll be surgeons, medics, stable hands, or nurses, technicians, and also imaging people, etc. So a lot of varying different backgrounds. And they'll come together to look at the case, and they'll consider what the various options are and whether they think that a particular option is viable or not. And they'll work with the they'll give advice about whether or not the chosen treatment route is, they consider it to be ethical. But what they then do is they then preset some prospective kind of interventional thought points. So things like, okay, so we're going to go ahead with the surgery, and there's 50-50 chance that the horse will survive. If the horse survives, there's also then a chance that the horse will hemorrhage later. If that happens, we've already decided now we're not going to treat the hemorrhage, because actually the horse has already been through a surgery which was very touch and go and involved a significant element of suffering. And so to put the horse through the invasive treatment or involved treatment, we're going to decide no. If the horse gets a minor infection, we're going to treat that minor infection, because there's a very good chance that the horse will have good quality of life afterwards.
But this takes a lot of planning, doesn't it?
Well, they've managed to get it down so that it's actually really efficient, and they're able to discuss the cases really efficiently and able to create those plans really efficiently. And the clinicians can then come back at a later date and say, okay, we've now hit this point, but we think we should discuss it again, or we're now in disagreement because the owner wants to continue and we're not sure that it's in the horse's best interest. Can we discuss that with you?
Because legally wise, where does a vet stand? So say an owner wants to continue, and this really does happen. I have had it happen many a time where I've said it's time, we need to call it a day, and the owner, but I'm not there yet. And you're really stuck. What is the legalities about owner choice, vet intervention, etc.? So let's put this into a arthritis context. We've got a 12-year-old black Labrador, arthritis in all major peripheral joints. So we've got knees, elbows, shoulders, we've got lumbosacral disease, we've got neuropathic elements. So we've got not just your arthritic inflammatory type pain, you've got spinal pain, so you've got neurological pain. The dog is on a number of medications. So we've got the dog's on Metacam, it's on gabapentin, it's on amantadine. The owner has done the lifestyle change. They've had physiotherapist intervention, and the dog is scoring really badly on our objective measurement chart, and we haven't seen any improvements. So we say we're using Vetmetrica, we're scoring badly, and the vet is saying, this is my opportunity to let this dog go. It is my job to now let this dog go, but the owner doesn't want to. Where do we stand on that?
I mean, it has to come down to communication. That's where the pressure of a 10-minute consult doesn't work, right? And that's where it can get tricky. But it's just about sitting down and discussing things like, what do we want for your dog? What type of lifestyle did your dog enjoy, and how does that compare to the type of lifestyle your dog's got now? And talking through some of those things that are much more emotive and upsetting, and kind of.
But legally, where do we stand?
Legally, if you believe that the animal is suffering unnecessarily or inappropriately, you could contact the RSPCA and ask for an opinion from the RSPCA. Or you could simply advise the client to get a second opinion. If communication really had broken down. I think in most cases it's that communication hasn't necessarily broken down, it just hasn't been maximally.
There was a brilliant article via the Veterinary Mediation Service. I don't know if any of you guys know, there is a veterinary mediation service, and they did a brilliant article in Vet Record last week. And it was lovely written, because it explained that most of the time it's communication that hasn't happened, rather than communication breakdown. Because communication breakdown sounds like you've had a row and you've fallen out and you can't converse at all. It just, quite often things just they just don't get said.
And there's an interesting piece in the Lancet that I wanted to read a quote from, because it's obviously, the Lancet's a human journal, but I think it's really poignant for the veterinary profession as well. So this is from the front cover of the Lancet last year, and it's about euthanasia and euthanasia choices. It says, a better death means more dignity, more symptom control, and more choice on how to die and where to die, and gives bereaved families / owners, in our case, a better experience of death. To avoid talking about dying jeopardizes these benefits.
That's really good.
And for me, it really hit home, like on a really emotional level, because what I realised was we're very good as the veterinary profession about, I think, supporting people with the end of life, at the end of life. What we're not very good at is actually preparing people for that before it's necessary to be making decisions. And what they're now saying within the medical field is that they're changing the guidelines to ensure that doctors are speaking to patients about how they want to die at an earlier stage before they're at the stage of dying. So they're a little bit more objective, if you like, and a little bit clearer headed. They've got time to consult their family members and to think about what the various different options are, down to whether they want to be buried or cremated, but they can think that through at a much earlier stage. And what they're saying is that leads to much less kind of turmoil at the end of life, and much less kind of extreme heartache over not really knowing what the right decision is, because they've had that time to make those decisions and decide what's right in their situation. And I know that there are a few practices that do this, and there are a few vets that kind of specialise in this end of life care, but it's still very much not the norm. And we still, I think as individuals, we still feel really uncomfortable, like even raising the subject. And yet actually, as soon as you get a puppy, the only one thing you know about that puppy's life is it's going to die. So, that's the one conversation that you can be sure will never be wasted. And I'm not suggesting you should all have that conversation at your puppy consults, but, it's something to think about.
I think it really is. And I was a little bit worried that, we were going to have cam followers leaving in droves, because we're talking about, still effectively, it's quite a taboo area. Cam is seen as giving options and creative interventions to manage your dog's condition as best as you can, as long as you can. And Cam really focuses on the foundational changes and not just relying on medications or interventions. But the truth is, Cam is also there to support you, because it will happen. And it might not be arthritis that takes your dog, it might be something else that takes your dog, but it is going to happen. So I'm sorry if anybody watching this goes, oh my God, it was really living miserable last night. But you're right, I feel it's so important. Again, put it back to about Holly, luckily, one of the good things about having anticipatory grief for about 5 years is you do go through it in your head quite a lot. So when it came, I was actually quite mentally prepared, because I'd gone through it again and again and again. But even then, in that situation, the decisions were coming thick and fast. And I'm going to say the stuff that we didn't know whether we should talk about. The ashes. I wanted her ashes in that acute situation. I said, I need the ashes. I'm going to have a private creme ashes. I want them back. They're sat there. I don't know what to do with them now. And that's a really common thing that happens to a lot of owners. I think in that situation, having not had a chance to think it through, you make quick fire decisions that often cost a lot of money, and they're fueled by guilt and fear and worry about
not wanting to let the pet go. You just want something to keep from the pet.
I think that there's two sort of points from this I'd like to add. One of them is that we, in the veterinary world, with our animals, we have the privilege, and it's a privilege, that we can end that suffering with euthanasia. We've all have relations or friends who have had a horrible, slow end to their life. And many people have said, gosh, you are lucky with your dog, you can actually end it and you can make it good welfare. I was going to say something else.
No, but it is a blessing.
But,
we shouldn't throw it away. That's the other thing. We should embrace it.
And we shouldn't feel guilty about it.
Yeah.
No.
But as you say, the only thing you know is going to happen is that you're going to die.
Yeah.
And I think this is the other thing I was going to say, that it's become a bit of a taboo to talk about death, because we've got lots of things which put it off.
Yes.
We're very good at better health in old age. Look how much older people live to, and they live good lives.
Yeah.
And we sort of push death under the carpet and almost pretend it doesn't happen. And we talk about passing. It's not passing.
I got told off for that earlier. I was trying to be polite. I was like,
But it's it's something that we need to embrace and realise that we can make that a good death.
Yeah.
Rather than some horrible trailing on, lots of pain, no decisions, guilt, lots of guilt.
Yeah, well, I was going to do a separate Facebook bit, but I'm just going to take 1 minute out of this amazing discussion to talk about what's happening in Holly's Army. So if none of you know what Holly's Army is, it's a community group that was created because when I was doing my home visits and doing the arthritis service in the home, I realised that there are many people out there that would have family, friends, husbands all around them, but they still felt really lonely. And decision making was very difficult. And by creating this online community, I wanted people to be looked after, no matter what stage they were at. Some people on their first diagnosis of early arthritis, it's devastating, they can't believe it. That's just as important for the person has got an appointment booked to say goodbye in 2 days' time. Your need has to be catered for, and that's the community group. So Holly's Army is there for that reason. That means we do have to talk about everything. So we've had a few people leave in the last few days going, oh, it's just doom and gloom on here. Oh, it's really upsetting reading these. That's life. I'm really sorry. There are going to be people on there that one day say, I can't believe how far my dog's walked. It's amazing. Look at him. He's doing brilliantly on his new medication. And there's going to be other people on there that are saying, we've tried all our interventions and we've decided what is right for him. That's life. It is a balance. So please stay with us and get the most out of Holly's Army.
And also euthanasia is not failure.
No.
Like that's the biggest marketing problem, if you could call it that, in the veterinary profession, is that somehow we've ended up relating to it as if it's failure, and it absolutely is not. The definition of euthanasia is good death. Oh, sorry, that's Nancy and Dennis. Nancy, come away. Nancy, come away.
Dennis?
Yeah,
Calm down, Dennis.
Sorry. The definition of euthanasia is a good death, and we owe it to all of our animals to consider what would be a good death for them. And I know that for me, for Dennis, I've already thought about how I would like him to go, and I'd like him to go at home in his bed with me here, with a catheter in and a long line, so that he's not stressed about people being in his face. So I've already planned that that's how I would want it to be, and anything that gets in that way, I would have to think very carefully about changing that plan, because that, for me, I believe would be the best good death that I could give him, and that he deserves that. It's an important part of his life. Is his death, and I want that to be as good as possible.
Definitely.
So I think that if anything, as well as stopping it from being a taboo, it would be a really good thing, a really healthy thing, if we could also relate to euthanasia as the gift that it is.
I would also like to now focus down on people that are listening to this and they're going, oh, do you know I'm in that situation? Let's choose an example. We've got a lady who has got a 4-year-old Labrador Retriever. It's got bilateral hip dysplasia. They've been trying to manage it conservatively. They're not doing so well, and they've seen their vet who said the only option is bilateral total hip replacement at a cost of £10,000 staged over an 8 to 12 month period, and that owner is just sat there paralysed, not knowing what to do. Maybe it's not insured. Dog's pretty young. They don't know if they've got the time to do the rehab. It isn't just a hip replacement and then it's a job as a done. How can we help them? And what can
it's
we
a
do?
really tough situation, isn't it? Really
I think there is no question, but that's a really difficult one. But I think the important thing is that if they feel that they really can't afford it, and they can't cope with the rehab, and with a bilateral, it's going to be a long period of around surgery and then rehab. I think that we've got to say, don't feel guilty about it. But in terms of the dog, euthanasia is a perfectly acceptable option. You remember your dog's short life as being a happy one, but you stopped it before it became horrible when you were in a position that you couldn't do anything further about it. Yes, there will be people who say, goodness me, you should have done that. But it's you and your dog, and if you can't afford it and you can't cope with the not inconsiderable time involved in post-operative care and so forth, it's better for the dog not to embark on it than to sort of half do it and then end up feeling horribly guilty when you call it a day a bit later on.
Yeah.
But it's not an easy one.
That isn't easy, is it? Okay, let's do another one that I commonly see. What about the owner who is having difficulties with their vet? So there's a lady, she's been on holiday in the last few days, and she said, you know, my dog's on 2 different medications, and my vet says that's all that can be done. And she's now really struggling because she's been at that vet for 10, 15 years. And she's on Holly's Army, and she's been reading CAM, and she knows that there are other things that she could try. What does she do? Help her out, you know?
I think ask for a referral. Ask for a referral or a second opinion. And actually, I mean, that's perfectly normal within the veterinary profession. So I would hope that any vet would not be offended by that and would support that. And
Did you hear that? It is normal. So all these people that come to Holly's Army and say that their vet isn't giving, you know, the service that they need, and that's not a problem for the vet. It just might be that they just are not gelling. We are totally okay with you getting a second opinion.
But I've also had people come to me when I was in first opinion practice and say, that all sounds very sensible, but I'm going to go for a second opinion and have time to think about it. And I'm like, yeah, that sounds like a great idea. We can offer you that within the same practice, or you can go to another practice. And sometimes they'll go to another practice, and that's absolutely fine. Some of them will come back and say, yep, okay, I've decided to go ahead. Some of them won't come back, and that's absolutely fine. We're providing a service, and that service has to be the right fit. You've got to have the right match. And we all know that, you know, you go and see some doctors and it feels right, and, you know, they're on your wavelength, and you go and see other doctors and you think, I won't go back and see them. Thanks very much. And that's the same with vets. So yeah, no one should feel that they have to remain loyal for all cases, for all animals at all times. That's just not realistic.
And one for Polly, because this one's a good one. What about the cases? We've got a dog that lumbosacral disease, and they're talking about maybe a distraction type surgery. So we're talking a really big spinal surgery where we're trying to gap L7, S1. We're trying to relieve pressure on the L7 nerves, and you know the figures are pretty bleak. You know, the caseload that vet might have had has been in under 10. And they sat there and they're paralysed. They just don't know what to do. How can we help them? Because that has featured, and I've just been gobsmacked about how can I advise you? Because that is a toughie.
I do think when it's a piece of new surgery, heroic surgery, almost experimental surgery, that the owner has every right to question what are the chances of this dog going back to living a life that's worth living. And this is where it's very easy to get carried away with thinking this is the only chance he's got. This is a new cool piece of surgery. But it's very important to ask those questions about what is the most likely thing that's going to happen here. How many have they done, and what was the success rate? And actually to ask for the information about how successful it's been.
And long-term success is what you're talking about, isn't it? Not the
bit of surgery, okay, the dog's going to be anaesthetised during the surgery. It's going to have, in this day and age, it's going to have good pain relief around the time of surgery. It's the recovery period when it's not living a normal life, when the owner has got to do an awful lot of looking after. If that is a very long period for a slightly dubious outcome at the end of it, it's perfectly acceptable to say, no, I'm not going to put Fido through this. So this is where evidence of what has gone before, what has been done before, in the same condition is important.
It is really important. We talk about evidence-based medicine a lot, guys, and that's a typical example. You know, what Polly is saying is that the evidence to support that successful outcome is poor, and therefore, you know, there's got to be discussion about it, because, you know, when you have that element of doubt, everybody's got to be on board and know what the possible outcomes are. Something that you said that I think people need to be reminded about is our ability to control pain is pretty good in these acute kind of situations, which means that you have time to think. So a lot of the musculoskeletal diseases, and do correct me if you think I'm wrong, we can keep these dogs comfortable whilst the decision process is in place. So we're not talking about a dog that's had a splenic rupture, it's bleeding out, and we seriously have got to think on our feet quickly about the welfare of that animal because we're in that situation. We have got time, if it be a few hours, maybe a day, 2 days. Some of these situations, we can go, right, no, let's pause. Well, nearly all of them, I would say. If you need to have that conversation, don't be scared to ask for it. It's absolutely fine. And if your vet isn't allowing you that time, then ask to speak to another one. It's totally fine. We had a little question about lumbosacral disease. His dog's on 600 milligrams of gabapentin, metacam, started Seroquin, on acupuncture. Is there anything else we can do? Go over to Holly's Army now. There are loads of people whose dogs have got lumbosacral disease, and we're always talking about it there. But my intervention, my must is non-slip flooring every time. So important. Stairs, non-slip flooring, lifestyle change, physiotherapy is really, really enrichment, you know, really, really important. But head over to Holly's Army, that will help you out there. Well done, Lynn. Join Holly's Army. You're on it already. She's amazing. So we've been chatting for about 46 minutes. What we're going to do is 10 top tips. Lynn will always say, yay, because she loves this bit. We're going to take it in turns. We've got 10 tips to give, and they're going to be very generic. They're going to be there for everybody. So we're looking at people from different financial backgrounds. We're looking at people with different physical backgrounds and, you know, access to different therapies. So we're going to keep it sensible. You can start. Top 10 tips. So a tip for an owner of an arthritic dog. What is something that you just would say, don't miss out on doing this?
Don't be carried away with exotic things that might make a bit of difference. Look at it from your dog's point of view. Is he enjoying himself?
I think it's really important. There's a lot of adverts out there now, and I'm going to say this. We see our members being targeted by a lot of supplement adverts now because of algorithms on social media. So a lot of you that are now following Cam will probably start getting a huge number of adverts flowing past your eyes about supplements, and many of them have no clinical evidence whatsoever. So just these fruity, boutique, quite costly, long-term, regular expenditure interventions, do question that. You will find most veterinary supplements that do have clinical evidence behind them do not advertise in this manner. Be aware. Number 9.
Licky mats.
Oh, yes.
So I think it's so important when you've got an animal that has a chronic disease, and particularly a chronic painful disease, that you're not just thinking about how to alleviate the negative welfare aspects, so giving painkillers to relieve the pain, for instance, but you're also thinking about how to give them positive experiences. So something like a licky mat or a snuffle mat as a way of being able to give them enrichment. It's something that they can enjoy. They can either have their food in that way, or they could have it as an addition to their meal times. And we talked before on a previous live about the kind of repetitive action of a licky mat and how it can be self-soothing. And with a snuffle mat, the snuffle mat involves olfaction because they're kind of sniffing out for the food, and that's also very linked to emotion and positive emotional experience. So I think it's really, really important, and it's something that you can do that doesn't require locomotion.
And you can go onto the camonlineshop.com and purchase those 2 things, and all money goes back into CAM. So we are a social enterprise group trying to become a charity, so all the money gets invested back in. So support us and put to our shop. For me, weight control, guys, it's so important. It breaks my heart that, you know, you see all these dogs that are struggling with pain, but they're also carrying about 2, 3, 4 kilos extra. It is a freebie. It's easy. Now, 9 out of 10 of you guys cannot see that your dog is overweight. We know this fact. 9 out of 10 owners with overweight dogs cannot actually see it themselves. And we see this all the time in the vet profession, where owners come in and they're like, look at my lovely boy. And you're like, he's got no waistline. Get a second opinion. Your nurses at the vet clinic, you know, doggy friends, and Holly's Army is now offering body condition scoring, a visual assessment where we just try and keep you on the right track. So please take advantage of that.
Can I underline that one? It's a human story. A colleague of mine, friend, it must be at least 6 years ago, was all set to have a hip replacement. And he went to see the consultant. He was going to do the surgery for his preoperative examination. And the consultant said, you know anything about losing weight? He wasn't particularly fat. He was quite big, but perhaps a bit overweight. And he said, no, he hadn't. And he went away, he lost weight, and he's never had to have the surgery.
It's massive.
So, a little bit of weight can make such a huge
difference. And they've done a very clear example why it's not just about fat and mechanical weight carriage, is that they know that overweight people have more arthritic problems in their hands, and they don't weight bear on their hands. So we know that it's an inflammatory component to making this pain worse. So it's not just the heavy saddlebags of fat, it's actually the fat itself is a source of inflammatory mediators. So petrol on the arthritic fire, get the weight off. Number 7.
The environment and non-slippery floors, ramps up to places that they like to sit, ramps up into the back of the car.
You've had about 3 there. What am I?
Sorry. You had snuffle mats and
True.
This is so important, and vet practices, listen up to this. You know, if you have got an owner who isn't quite with you, the fact that their dog is struggling, if your receptionists are trained to spot these dogs that have postural problems, movement problems, and they go and offer them a yoga mat to let their dog sit on in the waiting room, you're planting the seed that there is a problem that the vet needs to know about. Yes. So practices. Think about the environment that your clients and their pets are in. Okay. Number 6.
Oh, I had one and now I've forgotten it.
No.
Seriously. Oh, nails.
Yes.
So for dogs with arthritis in their toes and in their carpus or kind of lower limbs, I think making sure their nails are an appropriate length, and it'll be different for different dogs depending on what's comfortable for them. But obviously, as they're reducing in exercise, their nails can overgrow quite a bit, and that in itself might not be a problem, but it changes the angle that the joints sit at, and that can cause extra stress on joints that are already inflamed. So,
and again, likely to be a free of charge intervention.
Oh, and I've thought of another one. Do I get another?
No, come on again. You're number 6. I'm number 5. For me, and something that you should find on Cam Pro page soon is a piece about help 'em up harnesses. We as humans will employ a Zimmer frame when we're beginning to have difficulties. We don't wait until we can't use it. We use it to help us maintain our mobility, our freedom. We don't want slips, trips and falls because we know it causes further damage. It will make the situation worse. For some reason, we all employ these harnesses, these support harnesses, too late. We don't need to do it when the dog can't walk. We do it in the first signs that they're going to start stumbling and tripping so that we don't make it worse. So please look into harnesses, front end and back end. They can make a massive difference. Where are we now? Number 5. No,
you
4.
had 5. 4. Oh, are you going down or up?
I'm going down. Yeah.
Don't be.
I'm the only one drinking, by the way.
It's water, isn't it?
It is not.
Number 4.
Don't be pushed into lots of diagnostic tests to see how you're going and is it really all right to go on with these non-steroidals. If the dog hates going into the surgery and hates having blood samples, it's probably not going to make a great deal of difference, dare I say it, to the dog's quality of life. You're going to know if there's something drastic happened. So don't push them into all these pokings and proddings that they're going to hate.
Yeah, I think that one will be seen quite controversially by a number of people in it, and that's fine. So I think
mine now.
No, it's fine. I think I totally get that, because I think that when we're looking at pain and ownership, and this is a part of the dog's life you're never going to get back, so filling it with negativity of regular vet visits that are stressful to you, the dog, and as you say, destroy that relationship. But you could meet them halfway, maybe by doing a urine sample. You could,
or a fecal sample if you're worried about.
Yeah, that's a really good idea. And you can do measurements with measuring tape to see about weight loss and things like that. There are ways around it. We do try and get people to remain reasonably objective, but I totally get where you're coming from.
But also, I think little things for the vets that might be watching this, or for owners that want to request it. There's a big difference between taking a dog into the surgery and having it physically restrained at the elbow, which it may be painful in, to have the vein raised, and then held at the carpus, which it may have arthritis in, before the syringe and needle are put in, rather than just putting a butterfly catheter in, which can be put in with the legs standing in the standing position and just have the vein raised. The butterfly catheter goes in.
Do more about that.
Yeah, and then the blood sample's taken just by gravity.
Yeah.
So that, in my experience for the older animals, even for
I'm using Sophinis, for example.
Yeah, and I used to use it for induction of anaesthesia. So for animals that had arthritis, you just don't want to handle them at all, because they're usually hypersensitive. So even just stroking them along their back can sometimes just not feel nice.
Yeah.
So we used to use that technique for that, but then we could also get blood samples using
Brilliant.
it.
So that's called considered handling. We're going to trademark that from now because it's really important. You know, handling the animals in the clinic is so important to their experience and willingness to go back. Yeah, yes, totally. You're number 3. Go for it.
That was good, wasn't it?
No.
Slow walking. Slow walking is my big one. And actually, yes, animals to lose weight. Whenever I see fat animals that are struggling to walk, I get really sad. But also when I see owners that are on their phones and, you know, walking sort of briskly, it's not even that they're walking briskly, but they're walking more briskly than the dog would like them to walk. And I know we're all busy and we all get distracted, but actually some of the arthritic dogs want to walk at a snail's pace, and they would much rather just take half a step and sniff there for 10-15 minutes, and then a couple of more steps and sniff there for 10-15 minutes. They're not interested in the destination or the journey or going to the park necessarily. Some dogs are, but for those that aren't, it's not about the destination or journey. It's just about
current experience.
Yeah, the experience, and actually using their senses that don't cause them discomfort, you know, anything that's not locomotion based. So just being able to sit and observe or smell.
Yes. I do number 2, and then you've got the last one, so start planning, okay?
It's really got to be big.
So number 2 for me is something that me and Danny and Dawn, who are working, thank you very much you guys for coming up to Scotland to spend the weekend working on CAM. We talked a lot about communication and how difficult it is trying to introduce the concept that an animal might be in pain to the owner. It's conversations that are very tricky for the vets, and they're hard to break that topic, and there's a lot of denial and guilt and emotions. CAM followers help us. Start spreading the word. Start talking to your friends, your family members about how animals do express pain, behaviourally, posturally, capability. Do not allow the whole population to continue to believe that dogs need to be screaming and severely limping for them to be in pain. If we can educate dog owners, no matter what age their dog is, across the board, we are going to get improved welfare for these dogs. So take the conversation out there, use the hashtag YourDogMoreYears, introduce them to the website. There's no con. It really, really is just us trying to make a difference. So please talk about it. Number 1.
Physiotherapy.
Yes!
Over to you.
No, but it's true. I'm sadly not a physiotherapist. I'm just a very big lover of physiotherapy and rehab. It's so essential. You know, it is common sense in the human world for us to be employing the lifestyle changes, the therapeutic exercises, these manual interventions. It's so common sense, and it just seems to have vacated our treatment plans. So do not miss the opportunity to introduce physiotherapy, hydrotherapy, massage, any of those interventions. You'll be absolutely blown away at how powerful they are.
Should we do questions?
Yeah, let's have a quick look. Body conditioning 3 at Holly's. Well done, Lee Miller. You're awesome. Foot hair, brilliant one, Helen Bishop. Considered handling. Yes, Dawn, you're on it. Sniffaries, rock. Slow walking, brilliant.
Sniffaries, that's a good
name. Yeah.
I like that one.
So if any of you have got questions, then please put them in the box below and we will get to them. I can't thank these guys enough. Hasn't it been amazing? They are absolutely blinding characters. I always want them to come back. So if you say yes, come back, we might be able to persuade them. I know that Kathy, you're coming back because I've
already been on a
I know, but I live quite close to her,
me.
so I can get to her within 2 hours. I can't get to you quick enough, can I?
You could encourage the BT to sort out my internet.
I know. We tried to do one and her internet was so bad. We had to give up.
That's come all the way to Newcastle.
Yes. But I'd love it if you guys came back. We've had amazing response. Thank you, Andrew Hale, for saying lovely words. He will be featuring soon. Me and Andrew have recorded a load of interviews for you guys, talking about guilt, anticipatory grief, decision making. That's going to be coming soon. So thank you, guys. We will see you Thursday. I've got the lovely James Hunt joining us on Thursday.
I want to have him on Barking Brains. Can you?
I'll persuade him.
Yeah.
I'll persuade him.
Great.
So James Hunt is joining us on Thursday. We'll see you then.
Bye.
Goodbye.